Hi, and welcome back. This week we're going to be talking a little bit about policy things, which is one of my favorite topics. And so let's just get started. I suppose we have to start out by saying that as epidemiologists, the meaning for our reasons for our existence is policy. We collect data, we do studies, we ask questions and receive answers in order to influence public policy to protect the public health. So it's no accident that these things are linked, and I think as epidemiologists we really have to take our role as persons who professionally support policy very seriously. So find this an interesting topic. I hope you enjoy it too. ID and health policy. So first question we have to ask here is, what is health policy? Health policy is a highly flexible concept. And generally speaking, it's defined as a definite course or method of action or reaction selected by a government, institution, group, or individual from among alternatives, and in light of given conditions to guide and usually to determine present and future decisions. That's kind of a mouthful. Health policy can be a specific decision or set of decisions designed to carry out such a course of action, or a projected program consisting of desired objectives and the means to achieve them. So we're covering a lot of ground with what health policy is. It's policy to protect the public health, but it can have specific implications. So this is sort of a diagram of how policy is formulated. Problem identification, policy analysis, strategy and policy development, policy enactment, and policy implementation is one way. We're going to talk a little bit about each of these things. Within that is stakeholder engagement and education, bringing your message to the people who need to hear it. So policy versus regulation. Policy is a statement which defines priorities and the parameters for action. It's a set of principles for guiding decision making. This is in contrast to a regulation, which are written details about how the policy will be enacted and what the penalties for violating the regulations will be. So policy sets the parameters, regulation decides how those parameters will be implemented. Policies usually involve formal written statements, such as laws, for example, but can also be an informal way of doing things that most people are expected to know about or adhere to. So, for example, we have, or in the era of COVID-19, we have mask mandates, the policy that dictates that people should wear masks. And then there are certain regulations that spell out what the conditions of mask wearing are and what happens when people don't wear masks. But there's also states that don't have mask mandates that are merely suggesting, saying, maybe you should do this. And that's more of an informal way of getting people to comply to public health goals. Basic topologies, there's policy with a big P. These are laws, regulations, court rulings, administrative rules, budgetary rules, and entitlement programs. And there's consequences for not following or violating and tend to have impact on large numbers of people. In contrast to that, there's also policy with what we call little p. They're guidelines issued by a professional association, recommendations of expert panels, rules within institutions, local programs, and capacity building. These are smaller in scope, they're less formal, and there's weak or no consequences for not following. Some examples of policy with a big P are food and drug regulations, Medicaid expansion for TB, laws mandating that private insurance companies cover mammography screening, HIPAA regulations, state children's health insurance program. And then there's policy with a little p, which is guidelines, suggestions for how people should behave, reach initiative of the federal government, the DARE program in elementary schools, hospital policy to screen all patients for domestic violence. So policy that has teeth and policy that really sort of softly guides people in the right direction. What is done? So the one thing you could do is nothing, non-intervention, doing nothing. What are you going to do? Make suggestions and then just do nothing. Moral persuasion, provide information about things and exhort or implore people to do certain things. Incentivize, so subsidize or provide tax incentives. Procure, grant, buy, contract, buy, produce, make, all of the things necessary to implement policy. And then finally, law and regulation. So I think you can see here the health policy is very wide, encompasses a lot of different things. It's not just written laws and books, but all kinds of other things to guide public behavior. Policy instruments. There's legalization and legislation and regulations that dictate how people should behave or act, or businesses should behave or act. Taxation and financial incentives that push people along. Information and coordination that keep people informed. And then provision of direct service, which provides services directly to people who need it. So the question here is, can or should epidemiology play a role? I'm hearing a big yes. Framing the debate. Public health policy explicitly addresses health protection and disease prevention on a population basis, as well as influencing health services, healthcare utilization, and quality. Healthy public policy involving laws, regulations, formal and informal rules, and understandings that are adopted on a collective basis to guide individual or collective behavior. So we're talking about the difference between, population level policy and policy aimed at the individuals. Foundations for policy. Well, the biggest thing is values. Do we value public health? Do we think this is important that people live full and healthy lives? I would say yes. That's one of the reasons that I got into this business. The second is ideology. Do your politics and ideology, or your sort of the framework of how you view the world, influence your foundation for policy? Evidence is usually not the main influence on policy, but of course evidence is worth fighting for. However, it is the primary contribution of epidemiologists. It's what we have to bring to the table. Values, ideology, and politics are around everywhere, but as epidemiologists, the place that we can contribute is providing evidence-based suggestions. Policies needed. Decisions must be made regardless of supporting evidence. Is some evidence better than no evidence? Well, I would say, poor evidence, it could be worse than no evidence. That is possible. Can epidemiology provide any of the important evidence? I would say maybe in some cases. And what role should the field play? And this is sort of a question you have to ask yourself. My view is that we as epidemiologists provide a supporting role for the creation of policy. What barriers and social norms within science research exist? And this is a huge question. What keeps us from providing the evidence that can guide policy? The settings for designing health policy through government actions, right? Taking action to protect the public health. Laws, regulations, funding, providing money for research, education, prevention where it's needed. Issues. Where should the locus of control reside? Global, national, state, local? That's a huge debate that we can have. I think even in our small group we can have a debate about that, and people will have various different opinions about where the locus of control should be. Problems of coordination, responsibility, and accountability. And then we have multiple agencies, all with their own different priorities and different constituencies at the global, national, and state and local level. So there is no sort of one-size-fits-all policy. Policy is a very complex field, requiring addressing who does the policy impact, who are we bringing our message to, who are the stakeholders, and who's going to pay for it was a huge issue. Designing health policy is not necessarily the exclusive purview of government. The private sector also carry out policies and set policies. Producers and providers, for example, like pharmaceutical companies, set standards for different types of drugs that can be produced to address different public health issues. Employers implement health policies to benefit workers and customers. Insurance companies are a huge driver of public health policy. Nonprofit aid organizations, donations of products or services, disease or condition-specific programs. These are NGOs, nonprofit aid organizations are particularly good at identifying populations who are underserved and going out and setting policies to help those people. And of course, individuals and communities. Groups of people influence legislation at every level, local, state, federal. Informal community policies within existing laws or regulations. If you go to different communities, you will find different sort of attitudes or methods or different ways of setting health policy, different priorities. Goals may be general. For example, Healthy People 2020. They may increase quality and years of healthy life, eliminate disparities, and achieve health equity. And goals also may focus on specific kinds of problems, like for environmental hazards or behavioral risk factors. Impact is generally greatest when based on high quality scientific evidence, when we have something to back our recommendations up. Never sole or primary consideration in policy development, however. Evidence is important. Impact is generally greatest when we have evidence, but it's not necessarily the sole driver of policy development because we have so many stakeholders coming to the table. So these are some things I want you to think about. How does epidemiology contribute to public health policy? When should you, the epidemiologist, suggest or try to influence public policy? These are some things I want you to think about. Thanks for listening, and we're going to move on to video.